Hello and welcome back to another episode of the Clinical Career Collective Soap News. For those of you who are new to us and our mission, C3 is a professional development community for the mental health professional at large. We are here to support you so that you can learn, advance, and become the clinician the world needs. You can find us at our website, www.clinicalcareercollective.com, and on our YouTube channel, Soap News. Of course, we are extending an invitation to you to check out our C3 Facebook page at Clinical2 Professional and LinkedIn at Clinical Career Collective. I'm your host, Amity Cooper, and creator of the Soap News. As a trained clinician, I really benefited from applying the Soap Note method in my practice. So when I started C3, I thought it would be a fun way to craft a blog series that incorporated the same principles as the Soap Note. What better way to get updates, tips, inspiration, and reviews about relevant, on-point clinical and business topics affecting our industry today. Today's Soap Note is all about using VR, virtual reality, in mental health treatments. You've probably heard of it, or maybe you've even used it in your own practice, or at least played with it on different video games. But whether you're a complete VR beginner or a VR veteran, today's Soap Note will provide a better understanding of how and why to use VR in mental health treatments. Research has shown that meditation is one of the most effective ways to deal with stress. And during these past 5 years, the amount of people in the U.S. training their ability to be completely present and aware of where they are and what they're doing has significantly increased. A technological revolution in mental health care is approaching. At the front line may be virtual reality, or VR, a powerful tool for individuals to acquire new learning in the name of their mental health. Although there are many existing definitions of VR, we will use this one. I quote, "Virtual reality refers to immersive, interactive, multi-sensory, viewer-centered, three-dimensional computer-generated environments and the combination of technologies required to build these environments," unquote. VR has been shown to have great potential for enhancing the capacity of people dealing with various problems to participate in social interactions. For example, people with social anxiety disorders can use VR to practice simulations of difficult social circumstances in a protected and personalized way. And in recent years, VR interventions have appeared most extensively in disorders such as depression, anxiety, and a variety of phobias. VR has been practiced in combination with counseling and CBT for the therapy of addictions. The effectiveness of VR has been confirmed in the treatment of acrophobia, spider phobia, panic disorder, agoraphobia, body image disorders, binge eating disorders, and fear of flying. It has also been applied in cognitive recovery and practiced to help autistic people and children establish their skills required for independence. Even though VR therapy seemed to be better than no treatment, the efficiency of VR therapy over traditional therapeutic procedures is not yet confirmed. Based on evidence currently available, VR is thought to be a helpful tool for mental health interventions, medical training, and therapy. Still, we must keep in mind there's an insufficient number of studies on the effectiveness of VR therapy to make strong declarations of long-term abilities. So before clinicians manage to make practical use of it, the focus must be set on controlled studies with clinically identified groups. You can check out this Spanish company called Psious, PSIOUS.com, who is on the forefront of providing new VR technologies to the mental health field. They have collated successful and supportive new data for the mental health community to research and study. As with any new technology, incorporating VR is not necessarily a cheap offering. There are makeshift options out there, such as basic VR goggles that can be adapted to any type of cell phone, both Android and iPhones, and those generally run anywhere between on the really, really cheap, affordable pop-up kind, anywhere from $10 all the way up to about $50 a headset. Open source programs on Steam and player gaming services such as Twitcher are available to the general public, but you have to do your due diligence. Meditation united with VR technologies can be more accurate and make the rate of a person's process in learning a new skill easier. The ability of VR to imitate reality could significantly increase access to psychological therapies, while treatment results could be improved by VR's capacity to create new realities. Furthermore, using a headset allows you to be genuinely carried away, which helps you ignore any existing disturbances and focus. With VR, you can experience problematic situations many times, practicing and exposing yourself to learn new coping strategies via these evidence-based psychological treatments, and how to overcome difficulties and obstacles in a safe and secure environment that releases you from the pressure of offering to clients with sort of these phobias to go out into the world to try their hand on it. But with VR, you actually can control the pace and process and steps of exposure with your clients. Regarding progress, the speed at which patients progress through virtual therapy greatly differs. Some patients experience immersions rapidly, while some need several sessions, and others don't seem to experience any difficulty at all. The beauty of the VR is that you can control the pace and the speed at which you deliver the intervention. The number of VR sessions used so far often seems arbitrary, and studies will need to be examined more closely to figure out what that optimal number of sessions need to be for the treatment response you're looking for. It's hard to detangle the effect of therapy from the effects of VR and from nonspecific and placebo effects, so more research is definitely needed. It's important to make sure that benefits are a result of the VR itself rather than due to other factors that may be involved. And I think those are one of those things that as we see VR coming online and more available to more populations and to the greater general public, these are things that will need to be teased out. Some side effects that have been noted are nausea, dizziness, disorientation, eye strain, and several other motion sickness related symptoms are quite common with many of new VR users, and they're likely exacerbated by the nature of what VR reality is. And it sort of throws off your equilibrium, but that once you adjust to it, people have found to really adapt to it rather quickly. Now, let's look at some of the existing VR meditation apps that could assist you and your clients with relaxation, peace, and mindfulness. There's 3 that I'm listing here, and they're called Guided Meditation VR. It is a virtual reality relaxation app where you can recharge in exotic locations across the universe. Forget about your passport and locate the ideal atmosphere to calm without ever stepping out of the apartment. Relax in various lush meditation environments customized to stimulate and soothe your mind. WiseMind is an international platform for well-being activities in VR. Activities were created together with therapists at first-class educational facilities like Stanford and are used to improve patient health in hospitals and clinics. They are, at WiseMind, they are true supporters of mindfulness, and it's been proven they effectively decrease substance abuse, anxiety, stress, and depression. The third list here on the list is Relax VR, Rest and Meditation. This is a free app that has highly specified 360-degree video footage and spatial sounds. You can choose up to 10 stunning locations, such as the Northern Lights, Wineglass Bay in Australia, and many others. But they offer relaxing guided meditations in this VR reality to kind of complete your overall immersive experience. Lastly, if you are interested in learning more about the new and cutting-edge technologies affecting our mental health practices today, then I'd like to invite you to register for our monthly SOAP newsletter. With this subscription, you will receive a monthly review of all the weekly SOAP notes that we produce, and you will gain access to member-only interviews and conversations with special guest speakers, and you will have the chance to purchase our monthly SOAP box that contains products, coupons, and discounts to all of our mentioned items reviewed during each of these SOAP note recordings. I thank you so much for joining us, and I look forward to seeing you next time. Take care.